Good morning, students. Today, we will be delving into the intricate world of endocrinology, focusing specifically on the complex mechanisms involved in blood pressure regulation. Blood pressure is a critical determinant of cardiovascular health and plays a fundamental role in various physiological processes. To fully understand its regulation, we will explore the interplay between the endocrine system and blood pressure control. Let us begin our journey into this fascinating topic. The renin-angiotensin-aldosterone system, RAAS, is a key player in regulating blood pressure. Renin, an enzyme secreted by the juxtaglomerular cells of the kidney, initiates the cascade. In response to stimuli such as low blood pressure or decreased blood volume, renin is released into the circulation. Renin acts on angiotensinogen, which is converted into angiotensin I. This inactive peptide is then converted to angiotensin II by the angiotensin-converting enzyme, ACE. Angiotensin II exerts vasoconstrictor effects and stimulates the secretion of aldosterone. Angiotensin II has multifaceted effects in blood pressure regulation. Firstly, it acts as a potent vasoconstrictor, narrowing the blood vessels and increasing systemic vascular resistance. This constriction leads to an elevation in blood pressure. Secondly, angiotensin II stimulates the release of aldosterone from the adrenal cortex. Aldosterone promotes sodium reabsorption in the distal convoluted tubules and collecting ducts of the kidney, increasing blood volume and consequently blood pressure. Aldosterone, a mineralocorticoid hormone secreted by the adrenal cortex, plays a pivotal role in maintaining sodium balance. By acting on the renal tubules, aldosterone enhances sodium reabsorption, leading to water retention. This mechanism results in increased blood volume, an essential component in blood pressure regulation. Furthermore, aldosterone indirectly affects potassium and hydrogen ion excretion, further influencing the body's electrolyte balance. Vasopressin, also known as antidiuretic hormone, ADH, is synthesized and released by the posterior pituitary gland. One of its primary functions is to regulate water reabsorption in the kidneys. When osmoreceptors in the hypothalamus detect increased blood osmolarity or decreased blood volume, vasopressin is secreted. Vasopressin acts on the renal collecting ducts, promoting water reabsorption, thereby reducing urine output and conserving body fluids. This process contributes to the maintenance of blood pressure. In contrast to the hormones discussed earlier, atrial natriuretic peptide, ANP, acts as a counter-regulatory hormone, aiding in blood pressure homeostasis. ANP is synthesized and released by the atrial cells of the heart in response to increased blood volume and pressure. ANP promotes vasodilation, inhibits aldosterone secretion, and reduces sodium reabsorption in the kidneys. These actions result in enhanced excretion of sodium and water, leading to a decrease in blood volume and subsequent reduction in blood pressure. Catecholamines, including epinephrine and norepinephrine, are crucial mediators of the sympathetic nervous system's response to stress or stimuli. These hormones bind to adrenergic receptors in various tissues, leading to vasoconstriction, increased heart rate, and increased cardiac output. Additionally, catecholamines stimulate renin release from the juxtaglomerular cells, initiating the ROS pathway. Overall, catecholamines play a significant role in acute blood pressure regulation. Endothelins, a group of peptides released by endothelial cells, play a crucial role in regulating blood pressure. Among them, endothelin 1, ET1, is the most influential, exerting its primary function as a potent vasoconstrictor. When ET1 binds to specific receptors on smooth muscle cells within blood vessels, it triggers the contraction of these cells, resulting in increased resistance in the peripheral blood vessels. Ultimately, this leads to elevated blood pressure. Dysregulation of endothelin production or signaling has been found to contribute to the development of several cardiovascular disorders. Prostaglandins, lipid-derived signaling molecules, exert diverse effects on blood pressure regulation. Prostaglandin E2, PGE2, and prostacyclin, PGI2, promote vasodilation and inhibit platelet aggregation, contributing to a decrease in blood pressure. In contrast, thromboxane A2, TXA2, has prothrombotic and vasoconstrictor properties, potentially increasing blood pressure. The delicate balance between these prostaglandins influences vascular tone and overall blood pressure. Nitric oxide, NO, synthesized by endothelial cells, is a potent vasodilator. NO diffuses into smooth muscle cells, where it activates guanylate cyclase, stimulating the production of cyclic guanosine monophosphate, CGMP. CGMP regulates intracellular calcium levels, leading to smooth muscle relaxation and subsequent vasodilation. The action of NO on vascular tone is crucial in maintaining blood pressure within normal limits. Adrenomedulin, which is a peptide hormone secreted by several tissues including the adrenal medulla, plays a significant role in regulating blood pressure. It achieves this by inducing relaxation and dilation of blood vessels through its actions on smooth muscle cells. The vasodilatory effects of adrenomedulin assist in maintaining the balance of blood pressure and overall vascular homeostasis. However, dopamine's influence on renal blood flow can be summarized as follows. Dopamine binds to dopamine receptors in the renal vasculature, triggering a series of intracellular events that ultimately result in vasodilation. This allows for an increased flow of blood to the kidneys, which in turn enhances sodium excretion. It is important to note that dopamine's effects on blood pressure regulation are not solely limited to the kidneys. Dopamine also acts on receptors in other areas of the body, such as the heart and blood vessels, further contributing to its overall influence on blood pressure. Furthermore, dopamine's role in blood pressure regulation is subject to various factors and conditions. For example, in individuals with reduced renal function, dopamine's ability to increase renal blood flow and enhance sodium excretion may be impaired. Overall, the intricate mechanisms through which dopamine influences renal blood flow and blood pressure regulation highlight the complexity of hormonal control in the body. Further research is necessary to fully understand the intricacies of dopamine's role in maintaining blood pressure homeostasis. Cortisol, a glucocorticoid secreted by the adrenal cortex, has widespread effects on numerous physiological processes, including blood pressure regulation. Cortisol influences fluid balance by enhancing sodium reabsorption in the distal renal tubules and increasing water retention. Additionally, cortisol modulates the response to stress, affecting sympathetic activity and vascular tone. Consequently, dysregulation of cortisol levels can contribute to hypertension and other cardiovascular disorders. In conclusion, blood pressure regulation is an intricate process governed by a complex interplay of various endocrine factors. The renin-angiotensin-aldosterone system, vasopressin, atrial natriuretic peptide, catecholamines, endothelins, prostaglandins, nitric oxide, adrenomedulin, dopamine, and cortisol all have significant roles in maintaining blood pressure homeostasis. Understanding these mechanisms is crucial for diagnosing and managing hypertension and related conditions. By unraveling the complexity of endocrine regulation, we can pave the way for developing innovative therapeutic strategies and improving patient outcomes.